Hello, my name is Emily Yee. I'm a nursing student with Germanna Community College, and today I'm going to be performing a postpartum assessment. All right, and this is my husband.
Hello, my name is Benjamin Hankins, and I give verbal permission to be a part of this assessment.
All right, and so then we can begin. I'm going to knock on the door, make sure I close the curtain to ensure privacy. Hello, my name is Emily Yee. I am a nursing student with Germanna Community College, and I'm going to be performing a postpartum assessment. It should take no more than 10 to 15 minutes. Can you verify your name and date of birth for me?
My name is Benjamin Travis Hankins, 05/17/1991.
Excellent. So we can begin. We're going to begin with some questions about birth history. Did we have a C-section or a vaginal delivery?
Vaginal delivery.
Excellent. And were there any complications during delivery that you know of?
I believe there was some post-delivery hemorrhaging.
Great, so it sounds like we have a little bit of hemorrhaging, so we're going to pay extra attention to the lochia and to our uterine assessment. All right, so then we're going to get into our vital signs. First, I'm going to take the pulse, and while I take the pulse, I can also look at chest rise and fall for respirations. Respirations are 14, heart rate is 70. So now we can take a temperature orally. Read the temperature, it's 98.6 within normal limits. And now we're going to take a blood pressure. And while I'm putting this on, I can ask Mom if she has any pain.
No.
All right, Mom does not have any pain. (120/70) for blood pressure, within normal limits. All right, now we can get into a more focused assessment. We're going to start with the breasts. I would ask Mom if she was planning on breastfeeding or bottle feeding.
I'm going to try breastfeeding.
She's going to try breastfeeding, which means we can palpate the breast tissue. If she was considering or doing bottle feeding, then we would not, because that would encourage milk letdown and oxytocin release. Using the back of my hands, then palpate the breast tissue for engorgement, mastitis, or any lumps or bumps. And while I'm doing so, I can check the areola and the nipples for any trauma, dryness, or cracking or bleeding. And I can also check to see if the nipples are inverted. If they are, then that might cause issues for baby latching. Once I'm done assessing the breasts, we're then going to go to our uterus assessment. I would palpate the uterus, and if the uterus was boggy instead of firm, I would start a fundal massage. Take one hand, put it over the suprapubic to ensure that we do not have uterine prolapse. I take the side of my hand, locate the area of the fundus, and then start my fundal massage. And we're going to continue doing this until the uterus is firm and contracted. And while I'm doing this, I can also assess the lochia by looking at the vagina. And I would basically categorize it as either rubra, dark red, serosa, pink, or alba, a kind of white yellow. I would assess how much is coming out, as well as if there's any tissue or considerably large blood clots. Now that the uterus is firm, I would make note in the chart of where the uterus is currently sitting within the abdomen. Next, we're going to do our bladder assessment. I would check for any bladder distension. And I would ask Mom, when is the last time you voided?
About 5 minutes ago.
Mom voided 5 minutes ago. And how much would you say you voided?
About 250 mLs.
Around 250 ml, so that is a good urine. And was there any pain or discomfort while urinating?
No.
All right. And then we would go on to our bowel assessment, and we basically just have the one question of, when was your last bowel movement?
A few minutes or about 30 minutes after delivery.
Around 30 minutes after delivery, Mom had a bowel movement, and we'd educate Mom on bowel movements for the next few days, which may be hard considering the hormones that have the effect on the colon. And we would talk about Miralax and a high fiber diet to help with the passing of the stool. Next, we would go on to our episiotomy and perineum assessment. I would visualize the perineum. Did you have an episiotomy?
No.
Mom did not have an episiotomy. If she did, we would go through the RETA assessment, where we'd assess for redness, edema, discharge, and approximation of the wound site. But since she does not have an episiotomy, we're just going to visualize the perineum, and we're going to check for trauma or lacerations. It may be swollen and red, which is normal with vaginal deliveries. Next, we would go on to our Homan sign, where we check for DVT in the legs. I would ask Mom if she's been having any pain in her calf muscles at all.
No.
No? All right, but we're still going to check. So I'm going to have Mom bring up her leg. I'm going to hold under the knee with one hand, and I'm going to have the other hand below the foot. I'm going to cause sudden dorsiflexion. Do you feel any pain in your calf? All right, so we're going to straighten this leg, and we're going to do the next one. That's negative for Homan sign. Bring the leg up. Put one hand under the knee, one hand under the foot. Make dorsiflexion. Any pain? No? All right, so we're negative for Homan sign. Next, we're going to assess for emotional status of Mom, particularly baby blues. How has your emotional well-being been since having baby? How are you feeling?
I occasionally feel the need to cry.
Okay, so Mom occasionally feels the need to cry. A lot of hormones is coursing through her right now, so this is very typical. Do you have any feelings of hopelessness or any sort of depression along with your crying?
I think so, yes.
It looks like we're positive for baby blues, so I would educate Mom on resources such as her birth partner. And also from us, we're always willing to come in and check and talk. And we would move on from there and ask how bonding with baby has been.
Good.
Have you been holding, feeding, doing skin-to-skin contact?
All of the above.
Excellent. So it looks like Mom's doing a very good job of bonding with baby. Very important. And next, we're going to talk about ROGAM. What is your blood type?
O negative.
So since Mom's blood type is O negative, we're going to have to check baby's blood type and see if they're Rh positive. If baby is Rh positive, then we need to start Mom on ROGAM shots, which she already should have had her first injection during pregnancy, and to make sure the antigens don't cause any issues with any further future pregnancies. All right, so what I would do now to kind of close out is I would ask Mom if there's anything else that I can do for her or get her.
No, I'm good. Thank you.
All right, so what we'll do is we'll make sure the bed is as close to the floor as possible. We'd make sure the patient had a call button next to them. I would discard my PPE in the trash, wash my hands, and I would go chart. And I would also thank the patient for allowing me to assess them today.
Thank you.
All right, and that's it.